Now we move on to our third speaker, Dr. Viranna S. Chetty. It is our privilege to introduce Dr. Viranna S. Chetty. With over 3 decades of dedicated service at Shri Vinayaka Ayurveda Aspatre, a devotee member of Rotary International for 35 years, Dr. Chetty has a spirit of service and scholarship throughout. Please join me in extending a warm welcome to Dr. Viranna S. Chetty. Today, sir will be presenting on evidence-based Shamana, Raso Shuddhi Chikitsa for neuromuscular disorders. We welcome you, sir. Please give a round of applause.
So my session is going to become a totally evidence-based treatment. Since past 30 years, almost since 90, I have been into purely Ayurvedic practice, documenting each and every cases, taking a permission of the parent as well as the patient. Because 99% of the consultation is totally video recorded. So I asked the parent to give a permission to present in front of the other people, those who get a benefit out of this. First video, I'll brief about the case. This is the case of accident, road accident. It is a self-explanatory video, and in this case, nobody dare to give this kind of case in the hands of Ayurveda people.
3 days ಹಿಂದೆ ನೈಟ್ ಫಂಕ್ಷನ್ ಮ್ಯಾರೇಜ್ ಫಂಕ್ಷನ್ ಬರ್ತಾ ಇದ್ವಿ. ಹೋಗಿ ಫಂಕ್ಷನ್ ಮುಗಿಸ್ಕೊಂಡು ಊಟ ಮಾಡಿ ಬರ್ತಾ ಇರುವಾಗ ರಾತ್ರಿ 9-9:30 ಬಸ್ ಸ್ಟ್ಯಾಂಡ್ ಹತ್ರ ಸ್ವಲ್ಪ ಹಂಪ್ಸ್ ಇದೆ. ಹಂಪ್ಸಲ್ಲಿ ಸ್ವಲ್ಪ ಗಾಡಿ ಸ್ವಲ್ಪ ಜಂಪ್ ಆಯ್ತು. ಅವರು ಒಂದು ಸ್ವಲ್ಪ ಹೊಸ ಬಟ್ಟೆ ಹಾಕೊಂಡಿದ್ರು. ಜಸ್ಟ್ ಸ್ಲಿಪ್ ಆಯ್ತು. ಸ್ಲಿಪ್ ಆಗಿ ಪೂರ್ತಿ ಬ್ಯಾಕ್ ಸೈಡ್ ಬಿದ್ಬಿಟ್ರು. ಈ ತಕ್ಷಣ ಪೂರ್ತಿ ತಲೆಗೆ ಪೆಟ್ಟಾಗ್ತದೆ. ಅಲ್ಲಿಂದ ಫಾಸ್ಟ್ ಆಗಿರ್ತದೆ. ಅಲ್ಲಿ ನಾನು ಸ್ವಲ್ಪ ಲೋಕಲ್ ಹಾಸ್ಪಿಟಲ್ ತೋರಿಸ್ಕೊಂಡೆ ಸರ್. ತೋರಿಸ್ಕೊಂಡು ಸ್ವಲ್ಪ ಬ್ಯಾಂಡೇಜ್ ಮಾಡಿಬಿಟ್ಟು ಸ್ವಲ್ಪ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಟ್ಟು ಸಲ ಹಚ್ಚಿ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಟ್ಟರು. ಒಂದು 10-15 ನಿಮಿಷದಲ್ಲಿ ಸ್ವಲ್ಪ ಕೈ ಕಾಲು ಸ್ಟಿಫ್ ಆಗತ್ತೆ, ಪೂರ್ತಿ ಸ್ಟಿಫ್ ಆಗತ್ತೆ. ಆಮೇಲೆ ಅವರೇ ಹೇಳ್ಬಿಟ್ರು ಬೇರೆ ದಾವಣಗೆರೆ ಹೋಗ್ಬೇಕು ಅವ್ರಿಗೆ ಹೇಳಿದ್ರು. ಅವ್ರು ಬೇರೆ ಕಡೆ ಹೇಳಿದ್ರು. ಆಮೇಲೆ ಸರಿ ಅನ್ಸಲ್ಲ, ನನಗೆ ಸೀದಾ ಶಿಕ್ಷಣ ಡಾಕ್ಟರ್ ಬಂದು ಅಡ್ಮಿಟ್ ಮಾಡಿ ತೋರಿಸಿದ್ರು. ಅವ್ರು ಹೇಳಿದ್ರು
ಹ್ಯಾಂಡ್ ಮೂವ್ಮೆಂಟ್ ಆಗ್ತಾ ಇದೆ,
ಸ್ವಲ್ಪ ಪೊಸಿಷನ್ ಕ್ರಿಟಿಕಲ್ ಇದೆ, ಪ್ರಯತ್ನ ಮಾಡ್ತೀವಿ, ಗ್ಯಾರಂಟಿ ಕೊಡೋಕ್ಕಾಗಲ್ಲ ಅಂತ ಹೇಳಿದ್ರು. ಬಟ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಟ್ಟಿದ್ದಾರೆ, ಇಂಪ್ರೂವ್ಮೆಂಟ್ ಕಾಣ್ತಾ ಇದೆ.
ಗುಡ್,
ಚೆನ್ನಾಗಿ
ಅಡ್ಡಿ ಇಲ್ರಿ. ನನ್ನ ಹತ್ರ ಬೇರೆ ಔಷಧಿಗಳು ಇರೋದಲ್ಲ, 2 ನಮೂನೆ ಔಷಧಿ ಕೊಡ್ತೀನಿ ನಾನು. ಆಮೇಲೆ ಆಯಿಲ್ ಮಸಾಜ್ ಅದು ನೋಡೋಣ ಮುಂದ್ಗಡೆ. ಬಟ್ ದಿರ್ ನಾಟ್ ಬಿ ಡ್ರಗ್ ಇಂಟ್ರಾಕ್ಷನ್ ವಿತ್ ಅಲೋಪತಿ ಮೆಡಿಕೇಶನ್ಸ್ ಆರ್ ಎನಿ ಕೈಂಡ್ ಆಫ್ ಮೆಡಿಕೇಶನ್ಸ್. ಆಹಾರದ ಒಂದು ಭಾಗ ಎಲ್ಲ ಕೊಡುವಂತಹ ಔಷಧಿ ಜೊತೆ ನನ್ನ ಔಷಧಿನೂ ಕೊಡಬಹುದು ತಾವು, ಏನು ಪ್ರಶ್ನೆ ಇಲ್ಲ. 60 ದಿನದಲ್ಲಿ ಮಿನಿಮಮ್ 10-20% ಪ್ರೆಸೆಂಟ್ ಕಂಡೀಷನ್ದಲ್ಲಿ ಇಂಪ್ರೂವ್ಮೆಂಟ್ಸ್ ಬರಬೇಕು. ಸೊ ಲುಕಿಂಗ್ ಅಟ್ ದಿಸ್ ಐ ಎಕ್ಸ್ಪೆಕ್ಟ್ ಮೋರ್ ದೆನ್ 30% 60 ಡೇಸ್ನಲ್ಲಿ. ಬಟ್ ಲೆಟ್ಸ್ ಹೋಪ್ ಫಾರ್ ದ ಬೆಟರ್. ಅಟ್ಲೀಸ್ಟ್ ಮಿನಿಮಮ್ 20% ಆದರೂ ಬರಲೇಬೇಕು ಅಂತ ಹೇಳ್ತೀನಿ. ಬಂತು ಕಂಟಿನ್ಯೂ ಮಾಡೋಣ, ಇಲ್ಲಾಂದ್ರೆ ಏನು ಫಾಯ್ದಾ ಇಲ್ಲ, ಬ್ಯಾಡ್ರಿ ಅಂತ ಹೇಳ್ತೀನಿ ನಾನು. ರೈಟ್, ಓಕೆ ಸರ್.
Exactly after 30 days of treatment.
Swah Tatsankuro Rena Purbo Devasadini Yona Pachoyat.
ಹೆಂಗದಿರಪ್ಪ?
Ramadan.
ಹೌದಾ? ಏನ್ ತಮ್ಮ ಹೆಸರ?
Indra.
ಪೂರ್ತಿ ಹೆಸರು ಹೇಳ್ಕಲ್ಲ.
Indra Nuchi.
ನುಚ್ಚಿ, ಏನಾಗಿತ್ತು ನಿಮಗೆ?
ಗಾಡಿ ಮೇಲಿದ್ದ ಬಿದ್ದಿದ್ದೇವ್ರಿ. ಅದಕ್ಕೆ
ಆಕ್ಸಿಡೆಂಟ್ ಆಗಿ ತಲೆಗೆ ಪಟ್ಟತ್ತಿತ್ತಮ್ಮ.
ತಲೆ ಪಟ್ಟತ್ತಿ.
ಆಪರೇಷನ್ ಆಗಿತ್ತು. ಹೌದಾ? ಈಗ ಹೆಂಗದಿರಿ?
ಈಗ
ಆರಾಮದಿರಿ. ಅಡ್ಡಾಡೋದು ಮಾಡ್ತೀರಿ?
ಎಲ್ಲ ಮಾಡ್ತಾರೆ.
ನಿಮ್ ಕೆಲಸ ಎಲ್ಲ ನೀವು ಮಾಡ್ಕೊಂತೀರಿ? ಯಾವುದು ಏನು ತೊಂದರೆಗಳಿಲ್ಲ?
Why I do video consultation? Ayurveda has got everything in the text. We are lacking in just evidences. I need to create the evidences. Based on this, all you can practice evidence-based Ayurveda. And I am using 100% Rasaushadhis. The purpose of using Rasaushadhi, a dosage is a minimum, but the outcome, a result is abundance. Tremendously, we are getting wonderful improvement within a short span. So I ask every patient to give me a 60 days, irrespective of the early span of the disease or the present condition. In 60 days, they should improve minimum of 10-20% in the present condition. Then only I'll ask the patient to visit my clinic again. Otherwise, straightway I will say, please don't visit my clinic if you don't find even 10% improvement. This is the Down syndrome.
ಹೇಳ್ರಿ, ಮಗುವಿನ ಹೆಸರೇನು?
ಅಭಿಷೇಕ್.
ಪೂರ್ತಿ ಹೆಸರು?
ಅಭಿಷೇಕ್ ರಾಘವೇಂದ್ರ ಬಳ್ಳಾರಿ.
ಅಭಿಷೇಕ್ ರಾಘವೇಂದ್ರ ಬಳ್ಳಾರಿ. ಅಚ್ಚಾ, ಎಷ್ಟು ತಿಂಗಳ್ರಿ ಮಗುವಿಗೆ?
3 ತಿಂಗಳು.
3 ತಿಂಗಳ. ಏನ್ ತೊಂದರೆಗಳದ ಹೇಳ್ರಿ? ಹಾ,
ಅದಕ್ಕೆ ತೋರ್ಸೋದು.
ಹೌದಾ? ಆಯ್ತು, ಔಷಧ ಬಂದ್ ಮಾಡೋಣ. ಸಾಕಮ್ಮ, ಏನು ಬೇಡ. ಅವಾಗೆಲ್ಲ ತಿನ್ನಕ್ ಕೊಡ್ರಿ, ಎಲ್ಲಾ ಮಾಡ್ರಿ. ಅಭಿಷೇಕ್ ಬಳ್ಳಾರಿ ಅಮ್ಮ 3 ತಿಂಗಳಾಯ್ತು. ಮಾರ್ಚ್ದಲ್ಲಿ ಬಂದಿದ್ರಿ. ಮಾರ್ಚ್ದಲ್ಲಿ ಬಂದಾಗ ನಾನು ವಿಡಿಯೋ ಮಾಡ್ಕೊಂಡಿದ್ದು. ಈಗ 3 ತಿಂಗಳ ಆದ ಮೇಲೆ ಹೇಳಿ. ಅವಾಗ ಹಿಂದೆ ಸರಿಯಾಗತ್ತನ್ರಿ ಅಂತ ಅಷ್ಟ ಹೇಳಿದ್ರಿ. ಡಬ್ ಬೀಳೋದು
ಈಗ ಮುಂದೆ ಬರತ್ತನ್ರಿ. ಎಲ್ಲಾ ಜಗ್ಗಾಗತ್ತಾನ, ಎಲ್ಲಾ ಕಣ್ಣು ಇಡಾಗತ್ತಾನ, ನಮ್ಮನ್ನ ನೋಡಿ ಅಳಗತ್ತಾನ.
ಓಹೋ, ಗುರ್ತ ಹಿಡಿಯಾಕತ್ತಾನ. ರೈಟ್. ಆಮೇಲೆ
ಈಗ ಸ್ವಲ್ಪ ಕುಂದ್ರಾಗತ್ತಾನ.
ಅಂಬೆಗಾಲ ಮುಂದೆ ಹೋಗೋದು.
ಅಂಬಿಗೆಲ್ಲ ಸರ್ ಹಿಂಗ ದೊಡ್ಡ ಕುಂತ ಮುಂದೆ ಹೊಂಟನ್ರಿ.
1 ವರ್ಷ ಆಯ್ತಮ್ಮ. 12 ತಿಂಗಳ. 12 ತಿಂಗಳ ಮುಗೀತು. ರೈಟ್, ಹೇಳ್ರಿ.
ಕೈ ತೋರ್ಸ್ ಬಾ.
ಕೈ ತೋರ್ಸೋ. We can see the palmar lines.
Good. Very good. ಆಯ್ತರಿ.
ಈ ಕೈ ಒಳಗೆ
ನಾಚಿಕೆ ಆಗತೈತಿ.
ಏನೋ ಅವಾಗ ಫಸ್ಟ್ ಟೈಮ್ ನೀವೇನು ರಕ್ತ ತಪಾಸ್ ಮಾಡಿಸಿದ್ರಿ, ಪೆಡಿಯಾಟ್ರಿಷಿಯನ್ ಕಡೆ ಹೋಗಿದ್ರಿ, ಡಾಕ್ಟರ್ ಕಡೆ. ಅವಾಗ ಕೈ ತೋರಿಸಿದ್ರು ನಿಮಗೆ?
ಅವ್ರ ಕೈ ನೋಡೇ ಹೋಗ್ರಿ ಸರ್. ಇಲ್ಲಮ್ಮ ಇದ್ರೊಳಗೆ ಕೈ ಒಳಗೆ ಇದು ಹುಡುಗನ್ಗೆ ಹಂಗ ಇರ್ತೈತಿ ಅಂತ ಹೇಳಿದ್ರಿ ಸರ್. ಆದ್ರೆ ಇವಾಗ ಕಾಣಕತ್ತೈತ್ರಿ.
This is a present video of the kid, and he is going to a normal school in Hubli.
ನಿಂದ್ರ ಅಲ್ಲ, ನಿಂದ್ರ ಸರಿ, ದೂರ ಸರಿ, ದೂರ ಸರಿ. ಹಾ.
Here, the total number of medicine administered is 2. One is Kanaka Sundari Kalpa, which is my own preparation. Along with that, Smriti Vardhaka Rasa, which is a Medhya Rasayana along with that. This is a case of ADHD and ASD from Goa.
When you started recognizing there is a problem in my kid?
Like 1.5 year, his speech was not developed. Like his lack of speech was, and eye contact also was not there. Like he was not like different. He was like alone sort of. So more because of the speech. Speech was delayed and all. So that's why we just show one of the pediatricians told us that.
After 3 years of a treatment, all the aggravation, other symptoms which have come down, he is very good in singing. Even he is performing a speech in a school. Still the treatment is going on. Next, sir.
घनश्याम, कैसे हो अभी?
This is a challenging case. This is a case of cortical blindness. They visited, after visiting n number of hospitals, started the treatment. In 45 days, the boy could able to visualize the things.
हाँ, कार से आए?
आपके पास।
अच्छा, अभी क्या दिखाई देता है आपको? क्या क्या दिखाई देता है?
ये टीवी ना।
हाँ,
मैं एक ही सीरियल देखता हूँ, ना वो साथी दीवाना साथी इतना ही देखता हूँ।
उतना ही देखते हैं। अच्छा, पापा को पहचानते हो?
वो तो क्रिकेट की है, वो देखते हैं।
नहीं नहीं नहीं, वो सही है। पापा को पहचानते हो आप?
देखते हैं पापा, देखते हैं।
दिखते हैं? पापा दिखते हैं क्या?
हाँ,
कहाँ है पापा?
यहाँ पे।
यहाँ पे है। अच्छा, मेरा उंगली पकड़ो, कहाँ है देखो। गुड, वेरी गुड। वेरी गुड, वेरी गुड, वेरी गुड.
बहुत सारे आपके फिंगर
बहुत सारे
अच्छा बोलिए मैम.
बहुत अच्छी हो.
अच्छा, थैंक यू. थैंक यू. बोलो.
पहले के मुकाबले में अभी इसका थोड़ा सा देखने का
अच्छा.
इम्प्रूवमेंट लग रहा है.
हाँ.
पहले चलते वक्त किसी भी फर्नीचर से टक्कर लगता था, इसको दिखता नहीं था प्रॉपरली.
हाँ.
बहुत देर बाद पता चलता था सामान रखा हुआ है. अभी वो अपना एस्केप करके निकल जाता है उससे.
गुड.
वो एक हमें काफी सेटिस्फेक्शन हो रहा है.
हाँ.
और अभी थोड़ा बहुत बताता है ये चीजों को.
हाँ.
कलर वगैरह बताता है.
हाँ.
और
There was one case of atrophic testis of a 9-month-old baby. Suggested a surgery, but with the help of Rasaushadhi, within 2 months, we could able to visualize a left testicle along with the right one very clearly. So Rasaushadhi has got a tremendous power. So I ask all our colleagues who are there here, start documenting each and every case, so that will be beneficial for the future generation. And I also thank the AYUSH TV for providing this stage and encouraging our all Ayurveda people. Thank you.
Thank you, sir. The clinical cases shared by you offered a valuable insights into the practical application. Thank you so much. Now we move on to our next speaker, Dr. Spandan. It is absolutely pleasure to introduce a dynamic blend of science, healing and wisdom. Dr. Spandan is a dentist, osteopath and a craniosacral therapist with over 2 decades of experience in integrated health. Ma'am will be presenting on parasympathetic pathways for comprehensive neurological rehabilitation. Over to you, ma'am.
It's a very esteemed panel. I feel very humbled to share the stage with you. Osteopathy is a very recent science. It's come into India just about 10 years ago. And there's only one university that offers it as both a bachelor's and a master's. So osteopathy, even though it is body work, it looks at integrating and regulating the nervous system. There are 5 principles that osteopathy works on. Structure and function are connected. The body has an inherent intelligence that knows how to bring itself back to balance. Reign of the rules of the arteries, opening up circulation, helping movement, and working with the body as a collaboration. Can I have the next slide, please? So the common challenges that we have seen in neurological rehabilitative patients. I work with the Shri Ayurveda Hospital on Kanakpura Road, and we have an integrated approach. So we usually have referrals from all departments. We also have OPD basis cases coming. And what we have seen over a large plethora of cases is that there is reduced mobility, anxiety, apprehension. There is social isolation. There is a stigma associated with a neurological issue because they feel they're not up to the mark as they were before. There is, of course, a financial burden. There is also lack of awareness, which a lot of times affects the help that this patient can receive. There are balance issues which connect to the cerebellum and the brainstem, and residual effects of pain or trauma, which can be stored in the body in a structure called the connective tissue fascia. It's basically the fabric the body is made up of. And commonly, these emotions are grief, anger, or anxiety. Can I have the next slide, please? So taking you back to school, basically we understand that there is a central nervous system and a peripheral nervous system. And the peripheral nervous system has sympathetic, parasympathetic. Sympathetic is our fight-flight mode, our parasympathetic is the freeze mode. But on a day-to-day basis, we get up from your bed in the morning, get on with our day because of sympatheticus, and we're able to fall asleep at night because of parasympatheticus. A lot of times, regulation of the autonomic nervous system is affected, even in the post-recovery phase. We need to reconnect the connective tissue fascia in the body with the brain. The brain has a tendency to function at a given normal, which may not be the best efficient way, because compensatory patterns come into place once an injury has happened. So with osteopathic approach and with an integrated approach, we're able to reconnect the two structures. Also looking at other structures through which we can access the autonomic nervous system. And we also work with the gut, which is the seat of the enteric nervous system. It's called the second brain. And we do know that it has an intelligence of its own. Can I have the next slide, please? So regulation of the parasympathetic nervous system happens at many levels. First is the highest center, which is in the brain, that's the hypothalamus. The vagus nerve is at the forefront of research today. In fact, we are running a few collaborative studies at the moment. And vagus carries about 75% of the autonomic fibers. So it connects the brain to the gut. And the interesting aspect is 20% of the information goes from the brain to the gut, but 80% comes from the gut to the brain. So then working with the body as a whole becomes very important. When we work with the brainstem, when we help the autonomic nervous system to regulate, we help with improved neurotransmitter functioning, improved brainstem function. Interoceptor and sensory receptors, these are found in fascia. So, if somebody pokes you, it makes you feel very annoyed. But if there's a gentle, light, safe touch that is offered to the body, the response is very different. For a child who falls down and starts crying, the mother just caressing the child is enough to put the child to rest. That is interoception, and that is the intelligence of the connective tissue fascia. So we in osteopathy do a lot of work with the fascia and accessing other physical structures in the body that directly affect the vagus nerve. Can I have the next slide, please? So how do we truly comprehensively rehabilitate a recovering neurological case? We've heard amazing things. In fact, like I said, I'm supremely humbled to be standing here. But I work with a very esteemed group of doctors in the hospital also. And we brainstormed on it. And we figured that there are multiple ways in which we can be a powerful adjunct in the recovery of a patient who is undergoing other treatments also. So one of the most important aspects is the neural part, which is the vagus nerve by itself. Why? Because it helps in recovery, helps in getting inflammation out, helps in improving immunity, helps in the coordination between the nervous system and the whole body. It really helps the brain to respond to an environment rather than react. So we are moving the person from a space of threat to a place of safety. There is also improved brainstem function because, well, the reticular activating system is right there. Our survival instincts are right there. So when we help the nervous system to regulate, we are helping with brainstem function. And vagus directly affects the brain-gut axis. Other musculoskeletal structures that we use to work directly with the vagus is the diaphragm. So diaphragm is our big breathing muscle, right? And the vagus runs through it. So on the right side, you see a picture looking at the diaphragm superiorly and the one looking inferiorly. When restrictions around the diaphragm are released, not only are we helping regulate the nervous system, we are opening up circulation because the arteries and the veins, the aorta and the vena cava runs through it. It really helps the other structures, the food pipe, and then a few other nerves. And the attachment of the diaphragm is directly to the spine. So the big muscles of the back, the big muscles of the body directly coordinate with the diaphragm. See what happens when you feel very threatened. We start breathing very fast and very quickly. That sends a signal to the nervous system that you are not safe. And that in turn creates a cascade of reactions in the body that takes the body towards a sympathetic dominant state. When we just work with restrictions around the diaphragm, help the patient to take deep breaths, we are moving it towards a parasympathetic dominance, where the body is like, okay, if I can breathe deep, I'm probably safe. If I'm safe, I can digest my food better. If I can digest my food better, I can sleep better. And if I can sleep better, I can cleanse my body much better. So when we do musculoskeletal part of osteopathy treatments, of course, we work with many, many structures, but one of the dominant structures to access the vagus nerve is the diaphragm. Next slide, please. We work with connective tissue fascia. So Robert Schleip from the University of Ulm in Germany says fascia is the physical consciousness of the body. We talk about consciousness of the mind, our connection to a larger intelligence, but that which constantly is moving to give the body maximum efficiency is connective tissue fascia. On a daily basis, if you hit your elbow on the door in the morning and go, ow, 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 I've got a lot of pain. After about an hour, you have forgotten about it because the rest of the body has taken over. So fascia plays a key role in providing optimum, maximum efficiency in function. Interoceptors, no, I need to go to the previous slide, please. Interoceptors are specialized receptors that respond only to a light, safe touch. And the interesting part is the back pathway, the interoceptors go and report to a specialized area in the brain called the insular cortex, which communicates with the reticular activating system and helps to regulate the autonomics. Fascial memory patterns, if you have had a fall, if you have had an injury, the body is going to remember it. By the body, I mean the fascia is going to remember it. So the next time you probably are in a situation where your brain feels you might get hurt, your pain is going to come back. See, we have people who say, I had a slip disc, the disc can't slip, it's a misnomer, but I had a slip disc 30 years ago, I still have pain. A lot of it is fascial memory. So every time you're going to mimic something that created the injury, it's going to be an alarm signal. That can be changed and that can be rewired when we do gentle, specific body work along with the patient. Next, please. Gut. So osteopathy is craniosacral, visceral and musculoskeletal. So visceral part of the work is working with the internal organs. We have a beautiful lymphatic system of the gut called the glymphatic system. We have specific nervous system of the gut called the enteric nervous system, which constantly keeps giving feedbacks to the brain. There are so many reels on Instagram about the different chemicals that are produced in the brain, produced in the gut. But the crux is that the gut plays a very important role in telling the brain you are safe, you can rest, you can eat, you can digest and you can sleep. And that happens when we help the organs in the gut to move the way they're supposed to move. Next slide. So integrated approach to the patients in total in the way we work is empowering the patient with responsible lifestyle choices. Apart from all this, we request them to begin deep breathing exercises, meditation, yoga. I'm a meditator myself. Healthy choices in food, for which they either go to the Naturopathy department or the Ayurveda wing. And using the body as a friend. Because the moment the body becomes your friend, your mind has become a friend. The body and the mind are connected to each other. Last slide. So like the founder of osteopathy, Dr. A.T. Still said, to find health should be the objective of a doctor. Anybody can find a disease. We need to find a disease. We need to address it. But eventually the focus needs to come back towards health. And that's where collaborations are opening up, research is happening. And I honestly feel very humbled to be a part of this platform. Thank you.